Good morning, young ladies and would-be mothers. I am Dr. Brigadier Arvind Gupta, Chairman and Head of the Department of Pediatrics and Neonatology at Asian Institute of Medical Sciences. Welcome to the beautiful world of motherhood. As a young mother, you have a lot of apprehensions as to what will happen when you deliver the baby. How do you look after it? What are the various problems I'm going to face? So today we will remove these apprehensions, try to remove these apprehensions, I will say that, by telling you about certain things which are important for you to know and prepare yourself once you deliver the baby. The most important aspect of looking after the baby will be breastfeeding. And after I finish with the breastfeeding, I'll cover up certain aspects of baby care. So let's start with the breastfeeding. I hope all of you have your notebooks and pens with you. You can keep making small notes because you are likely to forget certain things. Breastfeeding is one of the most important aspects of bringing up the baby. The moment the baby is born till at least 1 year of age, breastfeeding remains an integral part of bringing up the baby. So you must know each and every step about it. Breast milk is called Amrit. You know why? Because it contains everything which a baby requires. Just the right amount of calories, right amount of proteins, carbohydrates, fats, water, antibodies, protective antibodies like immunoglobulins, and various other factors which are required for the growth of the baby. It is a well-known fact that a baby who is breastfed exclusively for the first 4 to 6 months is much healthier than the baby who is fed with the bottle and formula milk. It also helps the mother in reducing the weight. A lot of mothers think that it will spoil their figure. No, it is the other way around. In fact, it helps them in maintaining their body shape. So let's start with you can practice it the way I'm going to teach you. So I'm going to demonstrate to you with a little model, little cute doll. Note down the various steps and try to follow it, try to practice it at your home. The first step is position. Correct position for breastfeeding is very important because it will make you have to be comfortable. You are supposed to breastfeed the baby at least 8 to 10 times or maybe even more sometimes. So your position, sitting position or lying position should be absolutely comfortable. So you choose a chair or a position on the bed which is comfortable for you. Relax totally with your back supported. Once you are relaxed, you see these things. First position, this is the neck of the baby. This is called the nape of the neck. The nape of the neck should be at the crook of your elbow. This portion is called the crook of the elbow. So you put the nape of the neck at the crook of the elbow, and with this hand support the buttocks, grip them like this, so that the baby doesn't fall down. Okay, now what is coming between your breast and the baby's mouth? This hand. Don't try to push the hand like this because you will break it. Always tilt the baby slightly forward and then put the hand behind your elbow like this. Okay, now if you see, the baby's mouth is just next to your breast. This hand is free to do a lot of other things. For example, you want to drink a glass of water, you want to scratch your hair, you want to pat the baby, you want to hold the baby, you want to pick up something. you are supposed to hold the baby with one hand preferably. So is the position part clear? The first step is correct position. This is the position. Second thing, how do you put the nipple in? This is called rooting. Rooting means the baby goes towards the root, looks for the roots, and the root is the breast. You don't have to take the nipple and put it in the baby's mouth. It is very difficult. All you do is, this rooting word has come from what is called as rooting reflex. The baby goes towards the root. The moment you touch the baby's lips to your nipple like this, the baby will do this movement and take the nipple inside. This step is called rooting. Clear? So first step is position and the second step is rooting. Once the nipple is inside, most of the mothers, they make a clip with fingers and start feeding the baby. This is wrong. Please remember that the milk is in breast and not in the nipple. So the third step is the most important, and one step which is responsible for a lot of problems in the mother, like cracked nipples, pain in the nipples while feeding, bleeding from the nipples. And this step is called latching. Latching means to bolt. So now you are supposed to bolt the baby to your breast. How do you do that? Very simple. The baby has got the nipple inside, but there is nothing in the nipple. The nipple is very rich in nerves. If the baby starts sucking the nipple, you will have a lot of pain. So what you are supposed to do is just do this simple movement. Press the baby towards your breast. Is it clear? You are just doing this. So what has happened now? The mouth of the baby has opened. It has left the nipple, and it is covering the areola now. The baby will start sucking the areola now. So remember two steps, two important points. If your nipple is paining, and when you look down, if you can see your areola more than 1/3, your feeding is not correct. At least 2/3 of the areola should be in baby's mouth. So we have covered 3 steps: position, number 2 rooting, and number 3 latching. So that you maintain this latching position, it's a very tiring position. You are actually pushing it here. Take a pillow so that you can rest your hand here. Otherwise, gradually, after some time, your hand starts going like this. The baby leaves the areola and comes to nipple again. Your nipple will start paining again. So keep a nice pillow here so that your hand is supported. 3 steps over. Let's come to the 4th step. The baby is small. It starts sucking, right? So very small, the baby will start taking 1 drop, 2 drops, 3 drops. We need to assist the baby in getting more milk. So this 4th step is called assisting. Now what is assisting? We try to push the breast in such a way that instead of 1 drop, the baby gets more drops. So ideal is to hold the breast, the base of the breast, that means the back of the breast like this, and squeeze it like this. The moment you start squeezing it, instead of 1 drop, 4 drops will go in. So your feeding, which should have lasted 1 hour, will last only 15 minutes. Some mothers have big breasts, or they don't find it very comfortable. So what you can do is just press the breast from top like this. Instead of 1 drop, 2 drops will go, and you will finish the feeding in 25-30 minutes. This step is called assisting. So we have covered position, we have covered rooting, we have covered latching, and we have covered assisting. Now the next step. The baby is sucking. While the process of release of milk is going on, there are a lot of hormones which are released from the mother's brain. One of these hormones is called endorphins, peaceful hormone. The mother also feels very comfortable, and the same hormones are passed on to the baby, and the baby will go to sleep after some time. So you are supposed to do waking up. How do you wake up the baby? We are not supposed to hurt the baby. We will not hurt our baby. So we will not do this flicking the foot or flicking the arm. Okay? We will not do anything which will hurt our baby. So how do you do it? Just behind the ear, just press it like this, stimulate, give a unpleasant stimulus, not painful, unpleasant stimulus. The baby will do this, start feeding again leave it, you do this again. Some children, they don't respond to this. So take their foot, you see this foot? Take their foot, put a thumb here, ball of the thumb, not with the tip of the thumb. If you do this movement, it will hurt. You do this and press it harder till the baby gets up. Again the baby will withdraw the leg, start doing this movement, start feeding again. This process of waking up the baby will continue till the breast is empty. And how do you know that your breast is empty? Two things. One is your breast will feel lighter, and secondly, when the baby sucks on the empty breast, it starts hurting. Not the nipple, the breast starts hurting. That means the breast is empty. So, position, rooting, latching, assisting, and waking up the baby. The feeding process is over. So what do you do now? You burp the baby. What is the idea of burping and why should you burp? When the baby sucks like this. Puchu, 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 puchu. He breathes like this. Okay? So he is swallowing and sucking in a lot of air. This air which goes inside cannot stay inside your gut. Whatever air goes in the stomach, the baby will burp it out. Whatever goes beyond the stomach, the baby will keep doing this movement and start expelling, start farting. Got it? This air has to be expelled. Otherwise, when the air comes out, the milk will also come out. So what you do is hold the baby like this. See this position now, neck like this, okay, and very gently do this. Stimulate the spine. The baby takes 1 or 2 burps and that makes it absolutely comfortable. After that, you can put the baby to sleep. Understood? Now this is your complete process of breastfeeding. I hope this simple process is clear. You can put the baby to sleep. You can give him tummy time. We'll explain these to you once you come to us after the delivery. Exactly how do we do it, what are the problems associated with this, and various other precautions to be observed. Thank you very much.